So let's begin by looking at the transition to value-based healthcare. So we start off with the fee-for-service model, and that's the general model that we have been used to, where you pay for each service item separately. And what this really does is encourages the overuse of the healthcare system, leading to a lot of inefficiencies. And now we're making that shift to the value-based care system, which is also known as pay-for-performance. And what this is doing is linking reimbursements to outcomes and trying to drive a more efficient system where providers get paid once for doing the job right the first time. And the key in this is that it's all patient-centered care. So by using outcomes questionnaires, you can really measure the value that you're delivering. And for example, when we say outcome measures, this can be done two ways. One is clinical data that's collected during the patient encounter, and another way is patient-reported outcome measures that can be collected before or after and include things such as pain, quality of life, and functional improvement. So this shift is challenging our healthcare system to really reassess how value is quantified. And this is done by engaging healthcare consumers to become more engaged and proactive decision makers in their care. And it's really disrupting old practices and workflows to promote what patients care about the most. And what that is the restoration of their health and the ability to regain normal, productive lives. So let's take a look at this poor guy who's had a knee injury. And so we'll talk about what is the connection between value-based care and patient-reported outcomes. And so what the concept here is that why does embracing the collection of patient-reported outcomes data improve your value chain? And so there's two pathways to talking about this. The first is the MIPS quality reporting pathway, and this is the pay-for-performance reporting that we just mentioned. And this is where providers will get rewarded for delivering data on quality that shows better performance rates. And it not only helps them to avoid negative penalties, but it also sets them up for optimizing reimbursements opportunities, and this essentially affects their bottom line. So we know that for many small practices, this is just a small dollar amount. In the CMS for the MIPS for this year, we're only talking about 4% here, which may not make a big difference overall in the grand scheme of things. But where the real money is made, and it's how you can help patients recover faster, is by reducing revisions, reducing readmissions, and really helping them to get back to work faster, and also recommending your outcomes and your practices to other patients as well. And this is done by really reducing the cost of services per patient, and it drives value in real terms into your business. And so, as you can see, at the heart of all of this and these two pathways is the patient-reported outcome measures. And that's pretty much the entirety of this presentation.
And so I want to echo what Dr. Prasad is saying. And that really what we're talking about here are different paths that your practice can take to help improve your value chain by leveraging patient-reported outcome measures, right? So one option would be the MIPS route, sort of avoiding those penalties and better navigating the new payment program, but then also where the real money is reducing costs by better understanding your risks, right? And understanding your risks by using and collecting patient-reported outcomes forms is what we're talking about.
So let's move on to what are outcomes. An outcome is really an end result to a medical event, and it measures the quality of care that's provided. Outcomes are a primary component of value-based healthcare, and providers are reimbursed depending on the quality of the care that they provide. And OBERD is helping clients to improve and report on the quality of care through patient-reported outcomes, which are reportable data collected directly from the patient through surveys. And they can use this data to measure themselves against their practice, against our registry as a whole, or even on a national level. Let's move on to why outcomes are important. So outcomes give you data that's value-based payment applications, which means you can compare your cost and your resource use. And it really allows clients to slice and dice outcomes and really dig deep into their cost metrics to help eliminate wasteful uses. The second point here is that it also drives efficiencies in the clinic. And so since this data is patient reported, there's no manual entry that has to be done on the clinician's part or on the office staff's part. You can also evaluate whether follow-up visits are needed based on the outcome, and reducing the amount of follow-up visits will also reduce costs. And you can see and treat more patients more effectively.
And I just want to expand on that second point there, to drive efficiencies in the clinic. I have a fairly unique perspective in that I implement the software, or I implement patient-reported outcomes tools for orthopods and other practices. And when we talk about clinical efficiencies, it's not just that you're utilizing patient-reported data, but also considering the method in which the data is collected. So is that happening in the clinic? Is it happening outside of the clinic? And if it's happening outside of the clinic, what are the tools being used to collect, consolidate, and then make that data available to providers and to patients?
So furthermore, enhancing the quality of care is where physicians and practices can really use outcomes to recalibrate the quality of care in real time. And this is by identifying what works and what doesn't work early on and making the system more efficient. Data-driven consultations in care, where you can get it right the first time and reduce readmissions, thereby driving down your costs even further. And lastly, tracking outcomes also gives you the power to negotiate with payers through bundled payments and better rates. So the collections of outcomes data using validatable instruments is fueling this feedback loop, where you collect, analyze that data, track it over time, see how you can change your behaviors to really enhance the value that you're offering.
Right, so this is essentially just a great illustration of the application of the outcomes data that you're collecting. We've already talked some about how outcomes can improve your value chain, and again, this is just an illustration of that, right? So we're collecting data, we are applying the data, and then we're changing the behavior based off of what the data says to create some of the efficiencies we've talked about.